If your child has been diagnosed with ADHD, any form of autism spectrum disorder, or one of the many types of developmental and neurobehavioral disorders, then the next 10 minutes or so could prove very important.
The HIT Autism Support Group and the Hillsborough County Children's Board will present a free educational seminar on some breakthrough therapies for these problems and more. And here to tell us more are Dr. Nelson Mañé and Sharon Barron. Nice to see you both.
Good morning.
Is autism one of those diseases that has, for lack of a better term, morphed over the years into these other things that we're seeing happen, or what's going on? Because it used to be very cut and dried. You were either autistic or you weren't, and now there are a lot of different things that fall under that umbrella.
Right, they've changed the diagnosis to a spectrum. So the spectrum starts with ADD, ADHD, sensory integration, Asperger's, Tourette's, OCD, autism, and actually ends with schizophrenia. So it doesn't mean that you start out at one and 30 years you're down the line, but they all mix and match. So you'll have a child that has ADHD and he has a tic, or he's hyperactive and he's OCD. So really it kind of all blends together.
Wow, that's amazing. I don't think many people realize that those things are so closely related. We hear about ADHD and OCD all the time now, and to know that they fall into that umbrella and that spectrum, I think that's new information for a lot of people.
Now, Sharon, your child is afflicted with what?
Autism.
With autism. And so how old is it your son?
My son is 12 years old.
12 years old. So when did this manifest itself?
He started showing characteristics around a year and a half.
Okay.
He was diagnosed a couple of years after that.
And what characteristics, what are the early signs of autism?
The communication delay, that was the first piece. And then sensory processing issues, such as just lighting up candles on a birthday cake and singing happy birthday. He could not process the lighting, the visual piece, the audio piece of everyone singing.
He wasn't aware that it was happening, or I'm not sure how.
He processes it differently.
So what was it like to him? What did he see, or what did he not see?
Fear. It was fear.
Oh, okay.
That's normally when these children with autism display behavior challenges, it's coming from a fear.
And not being able to, maybe a confusion, it sounds like,
completely.
over what they're seeing and experiencing.
Right, that it's okay.
So how is he being treated, and how is he now?
He is doing wonderfully well. He's received many of the therapies which many of the children with autism and families explore out in the community. But I can tell you that he has made extreme progress with this latest treatment of service that's being provided to our children now in our community.
What exactly is that? Because what we have listed on our website, if you previewed today before the show, is HIT. What does that stand for, and what does that mean?
That stands for Hemispheric Integration Therapy, and really that's just taking current neuroscience and applying it in the office. So there's 2 points that parents should know. One is that the brain is plastic or changeable. You can change it from the day you're born to the day you die. So many parents are told that it's 6 years old, they blow out the candles, and it's all over. It's not going to get any better, and that's not true. So her child is 12. Obviously, he's older than 6. So we can stimulate the brain. We can fire different areas of the brain, the weakened areas that aren't communicating with other areas, and then the child's brain will actually change. And if you change the brain, you change the child.
So how do you stimulate parts of the brain? Is that through medication, or is that a physical stimulation? How does that work?
Physical stimulation. So we will go in through, check all the senses. We'll check their vision. We'll check their eye movements. We'll check their if they can process auditorily. A lot of times they can't process touch, or kids can't wear labels, or they need soft clothes or wet clothes they can't wear, or noises. They'll go in a restaurant and it's too loud. You see a lot of times, it doesn't have to be noise, it can be anything. They kind of tend to cover their ears. So we will find out where the weakened pathway is by examining them, and then if it's an auditory problem, we might use sound, we might use flashing lights, we might have different movements and patterns that we do to stimulate whatever area it is that's weak, because you want to get the brain to function completely. If one side of the brain is functioning less than the other, it's like two computers, a slower processor and a faster processor. They can't talk to each other as well, and then you don't get the optimum function.
So it's not a deficiency in the sensory mechanism itself, it's in the part of the brain that processes the information that's coming in.
And it can be anywhere from the receptor to the cord to the brainstem. You have to figure it out where it is. But yes.
In doing this therapy, have you discovered any other maybe unintended benefits of this process and doing things like this?
Well, the difference between this therapy and other therapies is this therapy increases the child's capacity, his brain capacity, so he'll get a global effect. So he may have sensory issues that clear up, he may move up 2 grades in reading, he may have a piano teacher that says he's playing the piano better. It all gets better.
So what's some specific examples, Sharon, if you could share maybe ways that your son has progressed now that he's doing this?
He's benefited by, he can speak in sentences now rather than in just sporadic words. Something as simple as your child getting a mosquito bite, getting that Benadryl cream and rubbing it on. You couldn't get any ointments on my son's skin. He was so tactile defensive. So now I can get sunscreen on, I can get lotions on, and just like he was saying, we do a lot of boating. And we get into the water, and he would get out of the water. He would have to change his clothes. He couldn't handle having wet clothing on him. Now he can air dry on top of the boat like the rest of us.
What type of a relief and what type of a burden has been lifted because of the therapy and the things that he's capable of doing now?
My son is more independent now. He doesn't require as high level of supervision regarding his safety issues and things like that. He's more interactive. He socializes more. He is eating other foods, doesn't have as many aversions to certain smells. Like if you would go into a restaurant, he could process some smells and he couldn't on some others, and he's become more tolerant into various environments now.
Is it fair to say you both have kind of a new life now?
Without a doubt, he's a different child. He was functioning at this level of where some would say close to severe and profound autism, and he's moved up into a higher level now to where he's functioning more with the average person. The average person can understand more of his needs and wants now.
Well, we could talk about this all day long, but you're going to get the opportunity to attend a free educational seminar. It's coming up on Saturday, May 8th with the Hillsborough County Children's Board. You can go to dreamsworthgrowing.com to learn more. You can also go to studio10.tv, and we'll link you directly there. So if you've heard anything today that really triggers a, hey, I need to know more, you're going to be able to do that, and completely free of charge.
Thank you both for being here.
Thank you so much.
Thank you.